Hey there, everybody. It's Dr. Roni MD here with a new do. I love it. My hubby loves it. I hope you love it too. And a new Quick Tip Tuesdays video. Okay? So, yeah, it's springtime. Time for like some newness. Cut off those dead edges and get rid of 2020. Get rid of just a bunch of stuff that we don't need no more. New goals and new information. Okay? So this week on Quick Tip Tuesdays, I want to see your feet. Show me them toes. Show me your feet, okay? Show me your feet. Yes, Dr. Roni MD has lost her mind. You're right. Because honestly, you're like, why in the world am I about to show you my feet? I'm not putting no pictures of my feet on the internet. Okay, those stay in my shoes with the socks on. Nobody sees that. Okay, nobody. All right, but if I or any other doctor is asking to see your feet, chances are you're one of our diabetic patients, and we are going to ask you this just about every time you come in. Now, why? Okay, why do we ask you to take off your shoes so we can see your feet? And you guys are probably used to it if you've been to your doctor for a while and had diabetes for a while, but you may not understand why we look at your feet. Okay, and if you're new, if you've never, a new diabetic patient, you might be wondering why. Okay, because I don't need you to see them crusty feet of mine. I don't need you to see my ashy heels. I don't need you to see my jacked up pedicure or that toe that goes like this under the other ones. Okay, but here's the reason. One, we want to see if you have any sores on the bottom of your feet. Okay, we are looking for sores. All right, we want to make sure that you don't have any cuts in between your toes, or really, really dry, cracked skin. Okay, we want to see if your skin is really, really dry to the point that, it's like I said, because it's dry and cracked, those little cracks can essentially be tiny little cuts, sort of like little paper cuts almost. Um, and, an infection can set up in there. Okay. And then also, we are going to be touching your feet at the bottom of your feet, the tops of your feet, and going up the leg because we want to know, can you feel it? Okay. Especially in our patients who say they're getting numbness and tingling in their hands and in their feet. So we want to know, can you feel us touching your foot as we're moving up? Okay, so why do we care about that? Why do we care about the sores or the cuts or the cracks or the dry feet? Okay, so diabetic patients, unfortunately, can lose some of the sensation in their feet. Okay, all that excess sugar that's in their body that they're not utilizing as well as they need to, and it's just floating around in there. Unfortunately, that can damage the nerves. Okay, and when it damages the nerves, that's something that we call diabetic neuropathy. So Neuropathy, diabetic neuropathy. When that sets in, you can't feel when your foot touches something. And sometimes you can't feel when you hurt your foot. So you could have a wound or a cut, or something stuck in your foot and you would not even know about it. Okay? And then all of the dry crackness, cracked skin, like I said, again, kind of like little paper cuts down there, infection can set in and you can't feel it. Okay? So that's why we check your feet every single time. All right. And all that extra sugar that's floating around your system can also damage your blood vessels, making them smaller than they should be and leading to poor circulation. Okay. And because you'll have poor circulation down to your feet, if you were to cut your feet or have a wound or, any sort of puncture on your foot, it's going to be harder to heal. Diabetics take longer to heal with wounds than non-diabetics, and that's because you can't get that blood circulating there with all the nutrients and oxygen and everything to then flush out, you know, the toxins and then bring along those healing, um, the cells in your body and everything that the proteins and enzymes and things like that to heal the wound or the cut. And so it's going to sit in there and it's going to set in. And unfortunately, if that happens, an infection may set in. It'll go in deeper. It'll cause an ulcer, which is a deep, wound. It looks nasty. It's dark. It's ugly. It's gross. Um, and then it could even set in even deeper and get to the bone, which could then damage your bone. Okay. So you've got the inability to feel it, so the diabetic neuropathy. You've got the poor circulation, so you're not being able to heal the wound as quickly. If the wound gets deep-seated enough and it hits the bone, now you've got bone damage. And unfortunately, that might lead to an amputation of that particular toe or that part of the foot, or maybe even the whole foot or a portion of the leg up to where that infection set in and affected the bone. You can also get gangrene because of the poor circulation and the infection setting in there. And some people may have seen that the dark colored, just sort of angry, messy looking foot, of someone who has gangrene. It's basically the that part of the foot is dying. Okay, so that's what we're looking for. We're looking for, the sores. We're looking to see if you have any, uh, you know, loss of sensation. Um, and at that point up to the knee, that's what we call the stocking distribution. And you can also have the effects in your hands up to your, close to about your elbow, which is what we call the glove distribution. Okay, so we don't want our diabetics to get to the point that they're losing sensation, um, and getting infections or have to get an amputation. Okay, now what's something that you can do as a diabetic? You can check your feet every day. Okay, because we only see you when you come in for an appointment, but you can check your feet every day or have someone in your home check your feet every day. Okay, you want to wash your feet. You want to make sure that you dry between those toes, okay? And make sure, when I say dry between those toes, like get the towel and dry in there. Make sure they're dry because you also don't want any sort of fungal infections like athlete's foot or anything else like that to kind of set up shop in there, okay? Then you want to moisturize your foot, so get, uh, you know, not just those really thin sort of lotions that you just find at the drugstore. You want to get a nice moisturizing lotion, okay? And hit the heels, hit the bottom of the foot, hit the top of the foot. Don't necessarily go between the toes per se, unless it's extremely cracked and dry. So, I mean, you can maybe put a little bit of Vaseline in there, but you want to keep that area relatively dry, okay? And then, moisturize up your leg as well. So you want to do that. Like I said, you want to have somebody, if you can't do it yourself, check for any sores, you know, and then wear closed toe shoes. You do not need to be out here with the flip flops and the cute sandals on, because if you step on something, you can't feel it. You have no idea that you just hurt your feet. Okay? So you definitely want to make sure that you take care of your feet, closed toe shoes, you know, moisture wicking socks, um, and make sure you go to your podiatrist. If you don't have one, hopefully your doc will refer you to one as part of your uh, treatment plan, your overall management plan of your diabetes. So you should be seeing your podiatrist 1 or 2 times a year just for regular maintenance. And if you have any other issues, especially with, say, the extremely dry feet, or nail growth, that you may not be able to get down there and clip your toes. Definitely see your podiatrist. They can take care of those sorts of things. Um, you want to be extremely careful for those out there who like to get pedicures. Make sure that you go to a nail salon that has someone there who is well educated and well trained in doing pedicures for people with diabetes. Otherwise, don't go there, because sometimes some of the tools that they use, to, file off the calluses, to get all the dry skin out, to clip the toenails and get deep down, to the cuticles, can actually cause a cut, or um, injure your foot in a way that may not injure someone else's foot who's not diabetic. And now you've got, obviously, a cut, an injury, a wound that is set up in there from getting your toes done, and it's not going to heal as fast. Okay, so again, like I said, if you're one of those types who wants to get your toes done, make sure you're going to a pedicurist who knows how to work with people who have diabetes, or just have your podiatrist take care of your feet in that regard, and then you can have somebody else paint your toes. Okay, so I hope this was some good information for those of you out there who have diabetes, or for those of you out there who are taking care of, or who have a loved one who has diabetes. So please share this information with them. Like the video, subscribe if you aren't already subscribing, and make sure you set your alerts so you can get all the future videos from Dr. Roni MD. And until next time, I'm Dr. Roni MD, and I'm being paid to take care of you.